Hi, this is Dr. Dinh, board certified dermatologist, and welcome to Skin Truths, our episode with our wonderful pediatrician, Dr. Mailinh. She's been a pediatrician for over 20 years, and we are so excited to have her today to review with us all the fun things about summer, sun, and supplements.
Hi, Lonnie, Dr. Dinh. It's a pleasure for me to get to be here with you guys today and to share a lot of experience that I've had in this field and taking care of children because it's my passion. So thank you so much for having me here today.
A big question that I have for kids is how do we protect them from bug bites? Like, when is a good time to
Ooh.
start DEET? Is that safe to use in kids? Or some people are talking about essential oils. What are your thoughts on that?
I think one of the best things to do is to understand timing of when insects are kind of out on the prowl. So at sunrise and sunset are the two times where most mosquitoes and insects that bite are out to feed. So if we can avoid sunrise and sunset exposure for babies and kids outdoors, that's probably one of the best things that you're going to cut that risk down quite a bit. But if we are planning on a sunrise hike or we are going to be out and about, a dinner outside, in the evening, there are good insect repellents that we can use. You mentioned DEET. DEET's been around for a really long time. It's a chemical called diethylmethyltulamide. It's long name, so that's why we call it DEET.
Yes.
It works by confusing the insects' sensory receptors so they don't end up even landing on our bodies or our children's bodies to be able to bite. So that's how it works. There are some concerns about the chemicals absorbing into the body and things like that for children. There have been a lot of studies that show that DEET is safe down to even 2 months of age, depending on the concentration of DEET. So most of what you're going to find over the counter is going to be within the safe range. So anywhere between 8 to 10% is considered safe. That'll protect kids from insects for about 2 hours. Okay, when you get up to about a 30% range, that's going to get us protection that lasts anywhere from like 4 to 6 hours or so. And so if it's a long hike or a long day out, I recommend the slightly higher DEET level for kids 3 and up. Okay, for babies, I like to stick to the lower percentages of DEET. And one big thing is for me is trying to avoid spraying it directly onto their skin, especially for babies and for younger children, because your skin barrier, like is much thinner. And so there's more absorption of product that can happen. So I like to do it on their clothes. One thing for babies, to try to avoid the use of any chemicals at all is like mosquito nets over their strollers. So lots of the modern day strollers come with that already.
Oh,
So
yes.
that's pretty helpful. Yeah. Although my
Absolutely.
kids try to climb right out of that.
I can imagine it being kind of hard when they're being covered by the mosquito nets, but it's probably going to be very useful. It's a
It is.
physical
And
barrier.
yeah, it's a physical barrier, and most of them are super thin now. They can see really well through it. The other big question is about essential oils,
Yes.
right?
Big
The use of,
question.
essential oils and more quote unquote natural products, right? So, one of the most common essential oils that are used is the eucalyptus oil. This particular product is effective at repelling bugs, but at very high concentrations, like pure, it can actually cause neurotoxicity. So we never want to use pure essential oil for this. It must be diluted down. Most of the over the counter products you're going to see are diluted down for this, but some people want to get the most purest form of everything. And so I warn a lot of my families about that because it can cause things like seizures and other problems. So we never want to put essential oils directly onto the skin of our children.
What about the essential oils that are infused in those devices that like help the room smell better?
I usually say no because we can't control how much and what percentage is getting breathed in, through the entirety of the night. So water is the best thing for that.
Do you ever educate your patients when they come into the office about tick bites?
Oh yeah, really good question. So luckily where I practice in Southern California, it's not a huge risk like we think in, forested areas like where you come from, like back east. So I do warn families that if we're taking our children out for hikes in wooded areas, we check the body and the hair and for ticks.
And I think educating the patients on the fact that although we live in Southern California, it's not like the Northeast, there is still the possibility of Lyme disease that can
Yes.
occur even in California. And I've had two cases of it already in California. And it was very hard to get to the diagnosis because you have to really go into the travel history. And sometimes when patients tell their provider that they had a tick bite, the provider will just be like, well, you didn't go to the Northeast, so I don't think it's going to be Lyme's disease. However, we are finding that there are some cases of Lyme's disease even occurring in California. It's just
Yeah.
with, the weather and all that stuff, it's not super common, but something for parents to keep an eye on, especially if they see tick bites on their children.
Yes, absolutely.
What do you usually recommend for patients when they do get mosquito bites or bug bites of any sort? What do you recommend the parents do for the kids?
Yeah, so we've tried everything to prevent it, but
Yes.
oh gosh, we got a bunch of mosquito bites. So cooling the area is going to be helpful. Hydrocortisone, like a 1% hydrocortisone we can find over the counter is pretty good. If it's very, very inflamed, we can also use antihistamines, oral antihistamines, like allergy medicines. Zyrtec, Benadryl is like Zyrtec's, older cousin that can cause a lot of other side effects like drowsiness and things like that. So I like to go towards the newer generation antihistamines like Zyrtec or Allegra or Claritin. But if that's not enough, and we really, especially if they're itching a lot at night, then Benadryl has a good place in the treatment regimen for that. Great at-home natural remedies that my grandma and my family have been using for years. We love aloe. So natural aloe, put in the fridge. That cooling aspect of it is really helpful. Calamine lotion's another skin soother that can be used, but those would be kind of my top hits for
Do
bug
you,
bites.
do you like those devices that suction out?
Oh yeah, the bug bite thingy.
Yes.
Actually, I own that. To be honest, yes. But the key with that is that you have to use it as soon as it happens. So that's kind of hard because
Yes.
most kids won't tell you, unless you're seeing it happen, because it does work. What the device is doing is it's sucking out the venom. So when it sucks out the venom, it prevents the histamine release that causes all the itching and all the side effects with it. So it does work, but the key is you got to catch it like right in the beginning. Once the venom sets in and the histamine cycle starts to release, it doesn't work as well after that.
Some of my patients, when if they have a history of eczema and they get a bug bite, they get a really, really exuberant hypersensitivity reaction, meaning like it will welt up, almost look like infected. So
Yeah.
occasionally with those types of patients, I do have them do a higher dose steroid like triamcinolone,
Right.
to the area just to really calm down that the itchy spot that's now like the size of a golf ball. And
Yeah.
some people do have that type of reaction. So if that's you, sometimes you do need a little bit more of a higher strength topical
Stronger
steroid and definitely do
steroid.
the cold compresses
Yes.
for sure.
I agree. Some of my families ask me, how can we tell if it's infected or not?
Ooh, good
So
question.
that's kind of a good question. So typically, if you're seeing a big old reaction, within less than 24 hours, it's probably a histamine release. It's probably like an allergic reaction to the bug bite itself. Probably not an infection itself. Infections usually take a few days to settle in. And with infection, you're often going to see some drainage coming from the sites. Thinking specifically about impetigo, you're going to see kind of a yellow, honey crusted color drainage coming from there. It becomes more painful, not just itchy. It typically becomes more painful. And so, or obviously if there's frank pus coming out of it. So those would be the signs that I would watch for.
And those that tend to scratch a lot will
Yeah.
get that area secondarily infected and cause these infections.
That's why the triamcinolone helps.
Yeah, it's just stopping the itch right away. When I bring my son to the pediatrician, we always have to fill out these forms like safety, like is he using a helmet? Is he, I don't know,
Brushing his
brushing
teeth.
his teeth, like all these safety things, which I love. I love to
Yeah.
fill that out because it reminds me about these things. I don't think I've seen anything written down from the pediatrician's office about sunscreen. Like, are you applying sunscreen for your children? Because it's not really on the handout for
Oh,
like your well-checked visits,
it should be.
right?
100% it should be. It is in my office.
Yes.
Maybe we need to send a gentle note as a reminder.
Yes.
But yes, sun protection is definitely on our questionnaires
Okay.
because it's something that most pediatricians do and should bring up because it is a very, very important preventative measure that we can have for not just for sunburns and for discomfort and damage to the skin now when you have a sunburn, but it's for skin cancer in the future. We know that skin cancer risk is extremely elevated in burns that we receive as children and teenagers,
Absolutely.
right? And so that DNA damage happens long before skin cancer arrives. And so sun protection is extremely important. It's something that I talk about every day, all day.
Do you recommend a specific sunscreen? I know for my patients, I see mainly adults. I always tell them you can use a chemical sunblock, you can use a physical sunblock. It's really whatever you like. But if it's children or in a adult patient that has a little bit more sensitive skin, I usually say mineral. Is that something that in the pediatric world, you guys are saying the same thing?
Yes, pretty much. It is something, demystifying this. You can definitely use sunscreen for babies under the age of 6 months, mineral, but it's better to use clothing and shade for them,
Agree.
hats. Yeah.
I agree 100%.
So I have some families ask me, like, when should we start sunscreen for kids and when is it safe? In general, the rule of thumb used to be 6 months and above. And the reason for that is not actually because under 6 months you can't use sunscreen or it's not safe. It is safe. We just don't want you baking your babies out in the sun. We want to use physical barriers such as clothing, shade. You want to keep your baby preventing dehydration, lots of things, right? So,
Have you ever had patients ask you about chemical sunblocks or sunscreens being endocrine disruptors? Because
yes,
I get that too.
absolutely, absolutely. So when we disrupt those hormones, a lot of bad things can happen, right? So are sunscreen hormone disruptors? There are some studies that and animal models that are showing that that's a possibility, excuse me. And so for children, I always recommend mineral sunscreens. Honestly, for myself, I almost always use mineral sunscreens also because the formulations are getting so much better nowadays. So, and another benefit with mineral sunscreens is that I love the fact that they work right away. You don't have to wait that 15, 20 minutes. A lot of people think, oh, I'll get to the pool or I'll get to the park and or the beach and then I'll apply my sunscreen. For those chemical sunscreens, it takes 15, 20 minutes for them
Exactly.
to work, to absorb enough into your skin layer to even start working. And so you can burn in those 15 to 20 minutes. Most of us will with fairer skin. And so that's another big benefit. In general, in children, I recommend mineral sunscreens. Yeah.
Yes. Going back to the endocrine disruptors, when they were doing the studies, they found that to be more prevalent with the chemical sunblock, the oxybenzone component of it.
Mm-hmm.
And so with the chemical sunblocks, there's not really, they mix it with a lot of different other chemicals because, certain chemicals will only block UVA, certain will only block UVB. So they were combining them. And so a lot of times patients, even adults, right? If they had a history of very sensitive skin, eczema, things like that, they would maybe become allergic to the oxybenzone, avobenzone like ingredients in the chemical sunblocks. And in children, the concern about the skin, absorbing the chemical a lot more as possible. And so they saw that it was really more with the oxybenzone.
Right.
So that's why I always say just stick with mineral. Don't even mess around with these other chemicals.
Mm-hmm.
With the new updates, right, in the last month, the FDA recently approved bemotrizinol. That's a new chemical
So
sunblock.
exciting. Yes.
So it's even though it's chemical, it actually has pretty good UVA and UVB, like very, very good with that type of blockage. And because the particle is so large, it's not absorbing into the skin. So that risk of it absorbing, into the bloodstream should not be like that versus, oxybenzone.
Mm-hmm.
That's a very exciting thing. It's been used in Europe for a very long time, and so now it's going to be in the U.S. It's not available yet in the U.S. I think a lot of companies are probably making it right now.
Right.
So I don't. I know with the Academy of Dermatology, the AAD, they don't have any recommendations yet about is it safe to use bemotrizinol in kids,
In children.
in
Yeah.
children. I don't think the Academy of Pediatrics has any guidance on that yet either because
Not
it's so
yet.
new.
Right. That's so new. So definitely something coming down the pipeline.
Mm-hmm.
Come back here to listen for advice on that soon. Right?
Yes. I do get a question about this often, which is should the sunscreen be a stick, a cream slash lotion, or a spray?
Okay. Yeah.
What do
Really
you
good
usually, yeah,
question.
what do you guys
Really good
usually say?
question.
I have my thoughts on it too, but what are
Yeah.
your thoughts?
So for babies and
Mm-hmm.
toddlers, absolutely, I try my very best to avoid sprays because they're going to inhale that, like we all do, right? Because Children that little, they don't know to hold their breath well like we would for older kids or adults. And so I like to avoid that because inhaling any of these, especially the propellant that's in the spray itself, can be very irritating for the lungs for kids. So we want to avoid that. Creams and sticks, I love because you know exactly where it's going, and you know you're touching it, you're smearing it onto the screen, you're putting it onto the skin. Even sprays, oftentimes my own kids too, I have to remind you, got to rub it in, you got to rub it in. A lot of people spray their body thinking that's enough, but it's just the little droplets are just sitting on top of your skin. It's not providing a good enough barrier unless you're wetting yourself completely, and then that drips, right? And so creams and lotions are going to be better because you can see where you're applying it. You know exactly where you're touching. Sticks are great on the face. I feel like you know exactly where you're applying that, but it's hard to put a stick all over the body. It does take a little bit longer, but I think it's worth the risk for that. Now that's my pediatrician answer. My mom answer for my two teenagers: they're not going to apply lotion. They're not well and not frequent enough. They're not going to reapply well with that. So I beg them at least for the first layer, put on cream, and then we'll use spray for reapplying, because every 2 hours we need to be reapplying this, or every time you get in the water you get out, even if it's less than 2 hours, should be reapplied too, right? So with reapplication, sprays can be helpful, I feel like, because it's fast and quick for that. But you got to rub it in. That's the key.
Yeah, I 100% agree. I always tell patients you want to start with the cream or lotion first, really get a nice coverage, and then you can use the spray as like a backup and kind of a touch up, because it's really
Yeah.
hard when my son is swimming, it's really hard to get him out of the pool or out of the beach water and be like, "Oh, let's reapply all of your, sunscreen all over again." He gets really upset about that. And my son has sensitive skin. He reacted to some of the extra ingredients in the stick.
Oh,
So we probably need
yeah.
to switch to a different stick. I won't say which brand he reacted to, but I do think that the sticks are good, but be cautious if they have a history of eczema, in case they could be something with the wax.
Yeah,
Patient education on sunscreen is so important, especially at a young age, so they're used to doing that.
for sure. For
What do
sure.
you usually recommend for sunburns, for treatment for that?
It's all about cooling the skin, just like any other burns, right? So cooling the skin, aloe vera, like I said before, one of my favorite natural remedies from home. I like to choose ones that don't have extra pigment, extra color, artificial color added in. There's no reason why your aloe vera has to be green.
True.
So then cool compresses to the area. You can also, if it's itchy and very irritated, we can use some steroid on top of it too if needed. So that would be the hydrocortisone, or taking a step a little bit higher if needed, the triamcinolone we use. And then absolutely, staying out of the sun to allow the skin to heal.
What are some emergency signs that parents should look for if their kid has a very severe sunburn?
Yeah, that's a really good question. So blistering, severe blistering. So where you're having fluid underneath the blister, not just peeling of the skin, extensive amounts of that, across the chest, face, large areas of the body. If they're having fever along with the sunburn, we'd be worried about some additional toxicity with that. And then obviously any signs of infection that is happening with the sunburn, like we talked about earlier with discharge or pus, those would be things that would worry me. And so I would say, seek medical care if we're seeing any of those things.
Yes, I 100% agree. And a lot of times, some people don't realize with kids, when they're getting these blistering sunburn rashes, they can get very dehydrated
Exactly.
because your skin barrier is what's helping to prevent dehydration. So when it's this damage, it can be very dangerous. So those are great signs to look out for. I get a lot of questions, even from my adult patients, that the reason why they don't wear sunscreen is because two reasons. One is they want vitamin D synthesis naturally from the sun. The second reason is they're afraid that it might cause cancer. No, no way is, your sunscreen going to cause cancer. Not using sunscreen is going to put you at risk of getting
100%.
skin cancer. And we see that a lot
Yeah.
now, even in our 30-year-olds, 40-year-olds, because they were tanning so much in their teenage years. You don't see that sun damage right away. It really starts coming out later on in life.
Mm-hmm.
And fortunately, the Academy of Dermatology has been really adamant about stopping indoor tanning salons, being
Yes.
available for the pediatric population. Because when I was growing up in junior high, I remember my friends would be like, okay, we have a dance coming up. Let's go to the tanning booth and get tan for our dance.
Yeah.
That I believe is not even happening anymore, to my knowledge. I mean, you see
Yeah.
these patient populations more than me, that junior high, right? Like,
Yes. Yes. So you're right. Back in the day, that was a thing. Fortunately, it's much less of a thing now.
yes.
Okay. But it's not gone. I hear a lot more about spray tans now. So I will take that over a tanning booth any day because direct UV damage is awful.
So, what are your thoughts about the vitamin D supplementation? For my adult patients, I
Mhm.
tell them I'd rather have you get your vitamin D through your diet and through taking a vitamin D vitamin like
Mhm.
supplement.
Rather than depending on the sun. Yes,
Correct.
because our ozone layer is not the same as it was, many decades ago with being able to filter and protect ourselves. So a lot of families who bring this up to me, I say, you know what? The dangers of sun for your child now is a lot different than it was for you or your parents growing up. So vitamin D supplementation is important because vitamin D is an important vitamin for not only our skin health, it's also for our bone health to prevent things like rickets. On top of that, for our immune system support too. So vitamin D is a multifactorial vitamin that's important for a lot of different parts of our body. So it's important to pay attention to that. It's one of the few vitamins that the American Academy of Pediatrics does recommend supplementation for all children. So starting from infancy, from newborn through the first year, we recommend at least 400 international units or 400 IU of vitamin D for all our breastfed babies and for formula fed babies who are taking less than 32 ounces. It's hard to remember that. Just give your baby a drop of vitamin D. It comes in like liquid form for infants, where one single drop will give you that 400 IU, which is enough to supplement for your body because it's not safe to lay your baby out in the sun.
Mm-hmm.
And then for children older than that, toddler years all the way through adulthood, before it was recommended that you can get it through food, and which you can, which is good. A lot of our milk products are supplemented with vitamin D. But again, you got to hit like 32 ounces. How many kids are drinking 32 ounces of milk a day? We don't really need that or want that. And so supplementing is important. And so for children, in the elementary school age through high school, it is recommended that they get anywhere between 600 to 800 international units a day of vitamin D supplementation.
Are you recommending the vitamin D to be in their multivitamin or just separately as vitamin D?
Really good question. I get this question a lot too. I don't love multivitamins because there's a lot of stuff in there that we don't need. Okay. And then it can mess with absorption of the vitamins that we actually do need. So I did bring up earlier, I said that there are very few vitamins that American Academy of Pediatrics recommends for a general healthy child who has normal absorption, is eating a good varied diet. Multivitamins are not something that I usually highly recommend for everybody across the board. But vitamin D and calcium, those are two important vitamins that are critical for our bone development and height growth and bone health for later on in life. So those are the two that usually I have most of my patients supplement together. If you can, because vitamin D is hard to be found in food naturally. So we talked about milk products or dairy products. And then salmon is another source of vitamin D, mackerel, sardines. I mean, not a lot of our kids are eating that regularly,
True,
unfortunately.
very true. My kid
So
hates that stuff.
yeah,
Yeah.
so it can be hard to find naturally in food. Calcium could be a little bit easier because it's supplemented in more things, but I say if you're giving it, give both together.
Do you ever do a vitamin D lab test, or is it just you just tell all of your patients for the most part start on a vitamin D supplementation?
Really good question. So, we don't test vitamin D regularly for everybody because I'll tell you, most of us are deficient in vitamin D. So the studies have shown that there's a very large percentage of our population, including kids, because we're getting better and better with sunscreen and avoidance of the UV rays. And so we're saving a poke for the kids. There's a blanket statement of vitamin D supplementation that should be across the board for all of the pediatric population now. We do test it sometimes if patients are having certain symptoms like chronic fatigue, they're having any bone issues, they have nutritional deficits, or absorption problems in their gut, we can test for vitamin D, but it is a very safe and effective supplement. And so the American Academy of Pediatrics and most pediatricians recommend it directly without needing a blood poke.
So what I'm gathering is the Flintstone vitamins that I grew up taking. Don't do that with
We don't need
our
it.
our kids now.
Yeah.
No need.
Yeah, because,
Just the vitamin D.
exactly. The other thing is oftentimes these multivitamins don't have enough vitamin D in it. And so you're getting a bunch of other things you don't need, and then you're missing the actual value that you do need in it. Yeah.
What a great point. I will need to pick up vitamin D for my son and my daughter.
Yeah, there's a lot of great products available over the counter for that.
What about probiotics?
Ooh, really good
Because
question.
adult patients, some of us love to be on our probiotics. What about kids?
I'm a huge proponent of probiotics, and I have been for almost 20 years now, even before it became a big fad, because probiotics they're healthy bacteria that we have naturally in our body, a lot in our gut, on our skin, and it's a huge part of our immune system to help us fight infection and keep balance and even produce vitamins for ourselves in our gut. So I think it's very, very important for us to have probiotics. Great natural sources of probiotics are pickled foods, right? So for me, love me some kimchi and some zichua. Vietnamese people eat pickled vegetables. And so taking a supplement of probiotics, I do recommend. Do we need it daily? If you can remember, it's great. But for me, like I said, as a pediatrician versus like a real mom at home, what I can remember, it can be kind of hard. So I do recommend probiotics for times when we have GI illnesses like stomach bugs, the stomach flu, vomiting, diarrhea. It's great at helping to replenish the healthy bacteria we have in our gut to help us recover faster. Probiotics have so many other great benefits through illness and immune support, like I said, also. And so it is definitely in my back pocket for immune support.
And do you usually recommend probiotics for the kids if they're doing antibiotics? Because I usually do that for the
Absolutely.
adults.
Yes, that's a great point. Yes, absolutely. So when we take antibiotics, we know we're killing off, the bad bacteria, doing things that we don't want in our body, but it does kill off our healthy bacteria in our gut too and in other parts of our body. And so replenishing that's really important. A good kind of just at home to remember key tip is to take your probiotics separate from your antibiotic. So
exactly.
at least a couple hours separate so that the antibiotic doesn't kill off the healthy bacteria we're trying to replenish in the probiotic. Yeah, so good point.
You brought up when kids get sick. Do you also recommend any supplementation with like vitamin C or zinc if they're going through colds or other viral like infections?
Yeah, really good question. So this is like a huge mainstay part of pediatric practice is getting through, all of the routine viruses and illnesses that kids have to go through to build up their own immune system and just with exposure, right? So there are some great supplements that we can use, like you mentioned, zinc, vitamin C, vitamin D is a part of that also. Elderberry is another part of that.
Ooh, okay.
Yes, elderberry and these are all supplements that have good scientific studies backing the support of the immune system through this. So, a lot of people say, take this to boost your immune system. You don't need to boost your immune system. Your immune system is fantastic at fighting these bugs. But if we're missing some of these vitamins in our routine day-to-day diet, when we're sick, supplementing with these vitamins can be helpful, right? None of these things magically make your immune system stronger, but your immune system needs these things to work well. And so elderberry is another great supplement. In addition to that, one of my favorites, and it has been for decades, is Manuka honey.
Oh, tell us more about Manuka honey.
Yeah, Manuka honey is fantastic. It's a natural honey that's made by these magical bees in New Zealand from the tea tree plant. And they produce a honey that's very, very rich in many proteins that help us fight infection and heal the skin very well. So we use Manuka honey in the ICU to help heal burn patients and prevent infection,
yes.
right? So we call it Medi honey. So there have been some really fantastic studies over many decades now that show Manuka honey helps with that immune support also, soothing the throat. So if you're going to grab honey, grab some Manuka honey. Of course, only if your child is older than the age of 1.
Right.
Yes, so not under 1 because we run the risk of
The botulism.
botulism. I'm sorry. Yes, a botulism for kids under 1. But over the age of 1, everybody should have some Manuka honey. It's very helpful.
Where can we pick that up? I like ordering that. Do you guys have a place that you guys order it from, or?
Yeah, so good question. So in my home, I get my Manuka honey from Costco, to be honest. So there's a couple things that you want to look for when you're buying Manuka honey. It is becoming much more popular now. You can find on Amazon. Trader Joe's has a pretty decent one too. What you want to look for, because there's different grades of the Manuka honey, right? So you want to look for one that has UMF, which stands for unique Manuka factor of 10 or higher. So 10 plus. So
Okay,
UMF
yes.
10 plus, and the one at Trader Joe's is 10 plus. The one that there's like Costco right now, I think is a little higher. It's even 12 plus. So that's a benefit. The higher in the unique Manuka factor rating, the more expensive it gets. It can get pretty cost prohibitive for some people. So I'd say like around the 10 to 12 is a pretty good range that's going to be clinically effective for care. And so there's another rating factor called MGO with this, which stands for methylglycoxyl, which is the component of the Manuka honey that is effective at helping us to fight bacteria and viruses and anti-inflammatory. And so MGO of like 263 or higher. That's a hard number to remember, but those would be the two numbers that I would look for. And make sure that it's a stamp seal that you see on the product, confirming that it's from New Zealand, because real Manuka honey only is able to be produced in New Zealand. And most of the products will have like a QR code which will show the independent testing, which I think is important to make sure that you're investing in a product that's good.
Oh, absolutely. I'm
Yeah.
learning so much. Number one, vitamin D, pick that up. Pick up Manuka honey, pick up probiotics. Okay to use vitamin C, zinc if the kids need it to if they're going through illness. Good to know.
So that sounds like a lot of things all at once,
Yes.
right? So another kind of like mommy tip for this.
Yes.
So one of my favorite products that I used for my kids growing up is from Zarbee's. It's a gummy called Immune Support, and it has the elderberry, vitamin C, vitamin D, and zinc all together in a pretty tasty gummy. My kids are pretty picky, and so
Fascinating.
that one's a pretty good one to
Okay.
to be able to get. And you can get at Target, or most pharmacies will carry it. Amazon carries that one too.
Oh, good to know.
And
That
it
makes
is
it much more
produced
helpful.
by a pediatrician too.
Very nice.
Yeah.
How about melatonin? With people traveling to different time zones because it's summer, do you recommend melatonin to help kids sleep, or what are your thoughts on like the usage of antihistamines to help kids sleep?
I reserve usually my usage of melatonin for children who have more chronic sleep problems, children who are on the spectrum, children with ADHD, children who have like a diagnosed sleep disorder. Because for me as a mom, even as a pediatrician, I really like to minimize medications and even supplements to things that have good science behind it. So melatonin is deemed to be safe. But we don't have a lot of great long-term studies for melatonin in children for regular usage of healthy kids like this. So I say kind of bite the bullet. Kids do really well. They tire themselves out when they travel anyways. Usually within a day or two, they're okay. So I don't love using these medications or supplements to help soothe sleep for travel for kids. For adults, that's a different thing because it can be debilitating and you need to work and things like that. But I think keeping them exposed to daylight during hours that you want them to be awake, and keeping lights dim in the evening hours, even if it may through travel be the reverse of what they normally have, that really helps your body's like pineal gland, like part of your brain that secretes melatonin naturally, to kick those cycles in really well for kids. You asked about diphenhydramine or antihistamines for
Yes,
sleep.
it's a mom trick that for the plane ride, I've been too
Yes.
scared to do it because I know that you can have like this reverse like
Yeah,
reaction, so
some
I don't even want
kids.
to risk it.
Yeah.
But what are your thoughts on that?
Yes. So to be honest with you, I never did this with my kids. My kids relatively pretty good on planes and good sleepers. But I do have families ask me about Benadryl or like diphenhydramine. Like I said, that was an older antihistamine that can cause drowsiness. And so for plane rides, I tell people there's a lot of other great ways to soothe your kids on plane rides. But if you have one that you just know is going to, has a history of going nuts on planes, try it at home, see how they react to the medication, maybe a couple days before you do it on the airplane, because like you said, there could be a reverse or paradoxical reaction with it, and it can cause them to be more hyper. And so we don't want that.
No, not
But
at all. Not
yeah,
on the plane.
I don't love the use of it for the sedation portion.
Yes,
Yeah.
I'm in the same boat. Well, thank you so much for joining us today. We are so excited to have you here, and I can't wait to share about our part two with our frequently asked questions.
Thank you so much for giving me the opportunity to share my experience as a pediatrician for almost 20 years and also as a mom, just real life stuff. This is my passion, taking care of kids. So thanks, guys.
If you enjoyed today's episode, please subscribe, leave a review, and share the podcast with someone who might find it helpful. This podcast is intended for educational and informational purposes only. It is not meant to replace medical advice, diagnosis, or treatment from your own healthcare provider. For additional science-based dermatology information, visit aad.org. To learn more about our dermatology practice, visit www.dindermatology.com.